So, starting with shin splints. Shin splints is a general term for severe discomfort or pain of your shins. If when you're running and it feels like your shins just feel like they're about to break every time you come down on them, chances are that's shin splints. It's a very general term, very common, and there are a few things we can do to help treat them and to help prevent them flare up.
So starting off with a little bit of massage, warm up. These techniques are basically meant to sort of help get the blood flow going before you actually start running, before you actually start engaging the muscle. Helps it sort of relax a little bit too. This can help reduce a lot of sort of like the shock of like, that first run. You all know running, trying to do things warmed up versus doing things cold, you tend to feel a little better, and it's just a little bit healthier. We're just going to do that specifically for the shins. To start off, the best thing I got a little bit of anti-chafing material. This is just basically a skin lubricant that you can spray on. People use it, for like rubbing in spots like that. Great for this. Literally just spray it on. Or I actually have some coconut oil. You can use basically anything that's going to reduce the friction on your shins. Like body lotion, coconut oil, skin lubricant, all that kind of stuff. What we're going to do, we're going to be focusing is basically, remember the shin. So there's a bone right here. It's called the tibia. And you have the anterior tibialis and the posterior tibialis. And these are the two spots you're most likely going to feel the pain, somewhere along this side. So we're going to focus on that for to keep this pretty simple. So what you can do is you can take your stuff, you can either spray it on or take a little bit of coconut oil. And what you're going to do is basically just find that ridge of that bone, just rub a little coconut oil in there, and then just take your thumbs and just run it up and down. And even if it's not bugging you, even if you don't have an issue with shin splints, there's always something good to do because you can find some stuff that's pretty tender. And you'll find it. And what you want to do is just rub it up and down, nice and easy. Make sure we're breathing. Remember, breath is very important in all of this. And you might come across a spot that you're like, whoa, that's really sore, or whoa, like that's where the pain is. That's where my shin splints are really hurting. Just gently rub that out for a little bit, okay? And for the first few times you do it, you just want to gently rub it. The first few days that you're kind of rehabbing it, you're warming it up. As it starts to get better, you can start doing pressure point massage, where you just stop on it and you push. And you breathe. And then you're going to basically want to take it and then rotate your foot a little bit, kind of engage that muscle while applying pressure there. Breathe on it like that. And you can feel that. And you'll do this, 3 minutes, 3 to 5 minutes. You'd be surprised if you start your watch at 3 to 5 minutes, it lasts a little longer than that. And you can do the same thing on the outer muscle too. Get some oil on there, and do the same thing. And this, again, you can do this. You should be doing this if you're hurt to warm up. You should be doing this afterwards, big time too. You're gonna want to massage after you run, before you run. This is stuff to help you warm up, cool down. You can use this at night before you're going to bed to really get some work done. You can use it in the morning when you wake up. All sorts of stuff. So that's what we use for that massage. So that's your fingers. And that's, I think, in my opinion, one of the most ideal things. You get in there with your fingers. You can really dig in there. You can really explore your own body and kind of get in there and find where it is you're sore, where it is you're sticky, where the scar tissue is. Kind of start to rub that out and get that blood flowing. And then we'll moving along. Then we come to the stick. So the stick really only works if your shin splints are on the outside, in my opinion. But something you can do for massage is basically just take it and gently rub it up and down. Very simple, and you can stop and you can do the pressure. Then you can roll it out. Basically, it's a lot of the same concepts and principles, just one's with a stick, one's with a massage, one's with your fingers, and then we'll show the foam roller in a sec. Now, something else is, a lot of times, even though your shins are hurting, we also want to be warming up our calves. So if we have shin issues, we always want to focus on our calves, because again, this whole lower leg, it's all used in unison, in conjunction with each other throughout our movements. So if this is hurting too much, we might be able to find some, I just found one right there, some little spots. I supinate a lot, so I get the outer part of my calves can be really tender. And yeah, so we just gently run it up and down, let the stick do the work, and you're just basically trying to get, promote blood flow, get some of that. Oh, what's going on, big guy? my production assistant back there is making some noise. So yeah, we just roll it up and down and up and down. And that way we are both rubbing out the sore muscles, and we're also helping warm up the calves too, to help them sort of maybe move along. We got the foam roller. Basically the same thing. If you're not familiar with it, we're gonna be rolling out our calves this way. and just rolling it back and forth, stopping on spots that are hard, or tender rather. There you go. Go back and forth and just take your time and breathe. Nice and easy. We don't want to be going too hard, right? The whole point of doing this type of foam rolling and massage and everything like that is to go to where we're kind of working it out a little bit, but we're not working it out so much that we tense up. They're like, ah, you know, you don't want to be doing that, because if the whole point is to get your muscles to relax and you're tensed up, well, if you're tensed up, you're not relaxed. And if you're tensed up, what do you think the tissue's doing? It's not. So kind of don't go too hard or too deep or too soon. You want to let your body sort of, let the tissue sort of guide you as far as like how deep or how intense you should be going. And then finally, oh, I got him over here. Oh yeah, let's do that. And then as always, this is how you basically would roll it out with a foam roller. And again, the foam rolling is really only good for shin splints that hurt on the outside of your shin. You can basically just go there and back and forth, back. Oh, this actually feels really good. Boom. There we go. And again, these are all things you can do. Are really good for warm up. And are really good for massage, for any type of therapy. And this is like, you know, a few hours after your run, you're hanging out, maybe you've woken up from your nap, or you're just about to go to bed. Do this for a couple minutes. You know, after that, just kind of let get the juices flowing again. Should be great. In addition to warm up, I want to introduce the concept of heat. So this is an electric heating pad. You can get these at your local CVS, pharmacy, things like that. You just plug it in, and if you have shin splints or really any type of, you're going to see this a lot. I utilize this big time in a lot of different types of soreness and recovery stuff. Just wrap it around what hurts, and just sit there. And for about 10 minutes before you run, you know, you can even get an ace bandage if you want. You can use a rope, you can use a yoga strap, and just sit there for about 10 minutes before you run. It'll help kind of, again, get some more blood flow going in there, get some heat, kind of, you know, get the muscle to relax. Okay, so we have massage with your fingers, massage with a stick, massage with a foam roller, and we have heat. These are all warm-ups, things you should be doing to warm up your shins and stuff, and the massage stuff you can do afterwards to really help you get better. Now we're going to talk about some exercises we can do to help strengthen our shins, to help both as a rehab and as a preventative care for shin splints. Again, these exercises and stuff like this, just like I said with the massage stuff, even if your shins aren't hurting, this is stuff you should be doing. If you've ever had shin splints, or even if you've never had shin splints, you should always be trying to strengthen and maintain your body. Just like, you know, just like a car, even if your car's not broken, occasionally you got to take it in to get a tune-up or get it fixed, just a, you know, a diagnostics check. This is stuff you should be doing semi-regularly. If you're healthy, you should be doing it daily if you're not. So the first thing we want to do is toe taps. Very simple. You just kind of find somewhere to lean up against, and you pick one foot up. This is the foot that we're going to be working our shin on. Just bring your toe to the back of your heel, right on your Achilles, and just tap your toe. Just do that 25 times. You can start to feel it in the shin. You do it 25 times, you can do it 100 times. Do it till it burns, and then do it a little bit longer than that. You really should be working your heel. There we go. Now I'm starting to feel it. And this stuff you can do before, this is stuff you can do after. Usually a lot of times you guys are doing your core routine after practice. Tack this onto the back end of the core routine. Awesome time to do it. All right, so the next exercise we have, you can use, I have a towel here and a seat. You can use basically your shirt, but after you run, you can take your sweaty shirt off, throw it down on the ground, or you can have like a gym towel or something like that if you're at the gym, or whatever. Anything kind of works as long as it can be bunched up. So you sit there with it down on the ground, and with your toes, you just slowly start to bunch it up. And you bunch it all the way up, and you do this 3, maybe 4 times. As long as you feel like your shins, and you can like put, kind of reach down, make sure you're actually engaging your shins. Help strengthen them. This also has the added benefit, also helps strengthen your foot too. All right. And finally, one of the more intense exercises, but one of the more simpler ones for your shins and for your feet, rather, to your ankles as well. Bunch of lean up. You lean up, bring your foot up, and what you're going to do is with your toes, you're going to make circles in the air with your toes. And you want to go counterclockwise, 5 ways one direction, and counterclockwise 5 ways the other direction. Now the whole point of this is basically try and take those circles that you're making in the air with your toes, and try and make them as perfect circles and move your foot as smoothly as possible. you might realize at first that your foot's kind of going like this. Well, that's to be expected, especially the first time you do it. What you're doing is you're basically seeing sort of the chinks in your armor, in your lower legs, sort of the little muscles. You have all sorts of little muscles. We're focusing on just 2 big ones, but you have all sorts of little muscles. And the more you can get those to wake up, and you get to engage those while you're running and strengthen those, that means that that workload, that when you're running and you're catching your body, that workload is dispersed. So the muscles that are getting hurt, the muscles that are getting overused are working less, because the work is being shared amongst greater muscles. Your muscles aren't asleep. You're waking up the nervous system. You're waking them up. And it helps reduce the stress. So again, find somewhere to live. 5 one way, 5 the other. And try and go slow and focus. It's not just like 1, 2, 3, 4, 5. It's 1. And you can even see I'm not too good at it either. 2, 3, and then the other way. 1. Take your time with these, with all of them. The more you do them, the more consistently you do them, they're just gonna be better and better for you. All right, ice massage. So ice massage is something that's gonna be really good for your shin splints, and it's also gonna be really good for your Achilles too. We will talk about that later on in the next video about the Achilles tendonitis. But for right now, we're just talking about the shins. A lot of times, what we really want is to also promote blood flow, right? So when we have inflammation, a lot of times it's the tissue swelling up and it's restricting blood flow, preventing a lot of the waste that we create during our exercises in our cells from getting flushed out, and also prevents new nutrient-rich blood from coming in. So ice massage is one way that helps sort of restrict the capillaries a little bit to help reduce some of that swelling, some of that inflammation, and the massage kind of helps sort of promote some of that blood flow. So you get some of that new fresh blood in with all the nutrients and everything we need to sort of recover. You just take a paper cup, I got them right here, pour them with water, and you freeze them in your freezer. Then you take the top and you just tear off a little bit, if I could do it, there we go. You tear the top off of it like this. Boom. Take a towel, because it is gonna get a little wet. And what's nice about this, with a bag of ice, you usually have to ice for, like 15, 20 minutes. It's usually 7 minutes. And you start off at first, just wherever it hurts, up and down the shin like that. Very simple. And this one you can actually do on the inside too. So you do it on the inside or the outside, depending on where your shin splints hurt. You can do it down here in your ankles. And you're just rubbing it out, and you'll feel it. So for maybe, if you're gonna do it for about 7 minutes, then if you do it for about 7 minutes, maybe the first 3 minutes, you're just getting it nice and numb, and you'll feel it. Just go back and forth, and then you can start really kind of digging into it. Do a little bit of massage right there, and you'll feel it. It feels good. And so 7 minutes of this going back and forth and back and forth. Again, reducing that inflammation, helping you with that pain, helping you with the swelling of the tissue, but also promoting the blood flow. So you get the new blood in with all the new proteins and amino acids and all that good stuff that's going to help your body recover and help your muscles grow stronger and get better. All right, there we go. All right, Eagles, thanks for watching. If you like some of the tips in this video for your shin splints, be sure to subscribe to this channel, and also make sure to share it with your teammates.